So MDMA, or ecstasy, okay? Methylene dioxymethamphetamine. The only part of that you need to remember is the amphetamine part, because we often forget about that. So this is a cousin of meth, okay? It's different, and the effects on the actual person are a lot different. But remember that you have a lot of sympathomimetic stuff. Bruxism is really common, where people like grind their teeth and so forth. And one of the biggest dangers that will actually acutely present to the emergency department is the risk of hyponatremia and seizures related to that. That happens a lot. We'll talk about that more in a second. There's long-term damage that is apparent on MRI scans, where people that do a lot of ecstasy, they tend to have like holes in their brain later on functional MRI scans. We honestly just don't know what happens if people take this for a long period of time, but it's probably not good. So how many of you guys have ever seen someone at a club that had like a pacifier like attached on a string around their neck? Like, these people are out there, okay? And the reason those people are out there is that they're on ecstasy. I just say this because I've actually seen people that had, like raverware kind of stuff come into the emergency department. And so what happens is these people have an oral fixation, and they want to have something in their mouth. There's no better way to put it than that. I tried a few different ways. That's just how it is. And so, believe it or not, there are adults, and it's particularly hilarious if you Google pictures of men with pacifiers at a club, but they just have something in their mouth. And that's because they have bruxism and dry mouth. So what do they start doing? They drink a lot of liquids that have lots of free water in it, okay? Sometimes it's just pure water, like bottled water. Sometimes it's other hypotonic solutions, like alcohol. So they'll just drink beer with it or something like that. But a lot of the stuff they have doesn't have adequate salt. So they get hyponatremia. And then once you get enough hyponatremia, you end up having a seizure. It's also likely the case that with these amphetamines that you're lowering your seizure threshold as well because of that.